good morning, good evening, good afternoon, all depending upon where you're joining us from. Welcome you all to the Solving Case Studies for Medical Coding Exam Group Study by AMCI. And we are at the week 4 or session 4. Yes, you heard it right. We are in the week 4, the final week of our CPT case study group study for 2024 classes. So yes, time really flies, isn't it? And we are here at the end of the year as well. So it's been, let me tell you first thing, let me tell you that it's been an absolute pleasure to have you all here with us in this journey. And over the past weeks, you all have done a fabulous job, and you have been showing how experts or how good you are with the long case study scenario. So thank you, coders, once again for joining us for the final week of the Tuesday night group studies. So let me not waste much time, and let me get started for this final week. I've got a lot of great questions and scenarios for you all. So the purpose of this group study session is to review the scenarios that will prepare you for the board exam case studies. So here at AMCI, we do follow a few steps to solve these long scenarios, one of which is to select the code that best matches your inventory. So how to solve a multiple choice case study a case study scenario for the board exam. We use, as I said, we use few steps. First one would be highlighting your keywords. We use yellow for the diagnosis, green for the procedures, pink for all the inclusive procedure. You have to highlight the keywords first, as I said. Second step would be to document your inventory, procedures, and diagnosis, and then select your primary procedure and diagnosis. Review your guidelines, select the code that best matches your inventory list. So when highlighting coders, keep in mind, do not highlight the following: the things that are observed by the physician, the closures, the sutures, staples, etc., hemostasis, which is also a bleed control, the drains, the irrigation of the surgical site, installation and removal of clamps and trocars, dressings, surgical risk as well. So we have our Mrs. J, AMCR Curriculum Director with us, and that's me, your instructor for the Tuesday night group studies, Mr. Sandeep, myself, and I'm joining you all the way from Abu Dhabi. And it's time to introduce or welcome my partner in crime in this Tuesday group setting. And let's welcome Miss Katoya. She is the one who is interacting with you in the chat for the most of the time, and she will be also joining us in helping us to read out these long scenarios. So let's welcome Miss Katoya as well. Welcome, Ms. Katoya. So goals for the presentation for this final week: we will be reviewing a radiology section, scenarios, pathology and laboratory, and finally the medicine section as well. So coders, how are you feeling today, and are you ready to start the session? Let me know the chat. How do I sound? Forgot to ask you. How is my mic? Great. Hello, welcome everybody. I can see everyone in the chat. Okay, so let's keep up this spirit, and let's make the final session interactive. Place your answers in the chat. Keep asking your questions. We are here to help you out. So let's begin the final week with the radiology section. And here's your first scenario for the night. And let's welcome Ms. Katoya to read the first scenario. Ms. Katoya, please, and thank you.
Okay. What are the CPT and ICD-10 CM codes reported? A, 76770 modifier 26, Z48.816, N13.70, N28.81, N27.0, B 51798 modifier 26, Z48.816, N13.7, N28.1, N27.0. C 76700 modifier 26, Z48.86, N13.7, N28.81, N27.0, and D 76775 modifier 26, Z48.816, N13.70, N28.81, N27.0. Location, regional hospital. Study, ultrasound, urinary tract. Indications, status, urethral reimplantation to evaluate for continued vasochoroidal reflex. Left kidney length 7.0 centimeters, prior length 7.4 centimeters. Parasitmia, cortical scarring, pelvic dilation normal, calcium dilation normal, hydronephrosis grade normal, right kidney length 6.6 centimeters, prior length 6.4 centimeters. Parasitmia, I can't say it really well, cortical scarring, pelvic dilation normal, I think it's calcium dilation normal, hydronephrosis grade normal, inter interval interval hydronephrosis change none, ureters normal, bladder almost empty and difficult to evaluate. Impression: interval right renal enlargement without hydronephrosis. Stable asymmetric small left renal size likely to represent diffuse cortical scarring. And coders, you have 2 minutes to solve.
Okay, coders, that is time. And how are you all doing? Let me have a quick look into the chat. Good. Okay, so thank you, Ms. Qatar, for reading those first scenario. Yes, it is at times difficult to read those medical terminologies. So great work. So let me highlight the keywords. We have ultrasound of urinary tract performed, um, indication status urethral reimplantation, vesico-urethral reflex, left kidney was examined, right kidney was examined, ureters and bladder as well. Okay, so impression, we have right renal enlargement, no hydronephrosis, and a asymmetric small renal size. And the correct answer for this scenario is going to be option A. And how did I arrive at this answer? So for that, let's have our procedure inventory, in which we have ultrasound of kidney, ureter, and bladder performed. And in the diagnosis inventory, we have aftercare following surgery on genitourinary system. And number two, we have right renal enlargement and small left renal size as well. So let's look into option C. It is coding for 76700 with a 26 modifier, and 76700 is coding for ultrasound of abdomen. So it's time to cross check with our procedure inventory. We had an ultrasound of kidney, ureter, and bladder rather than an ultrasound of a complete abdomen. So we only had kidney, ureter, bladder, which was examined. So that means option C is incorrect. Okay, let's look into option B. Now 51798, that is coding for measurement of post-voiding residual urine and bladder capacity by ultrasound non-imaging. So we didn't have post-voiding uh, bladder capacity measurement performed here. It was an ultrasound of kidney, ureter, and bladder. So option B is also incorrect. Now between option A and option D, how would you select the correct answer? So option D is coding for uh, 76775, that is ultrasound of retroperitoneal limited, and option A is coding for an ultrasound of retroperitoneal complete. So which one is correct? For that, we will have to look into the guidelines, and these are the guidelines in your CPD manual, which states that yes, a complete ultrasound examination of retroperitoneum 76770 consists of real-time scan of kidney, abdominal aorta, common iliac arteries, origin, inferior vena cava, including any demonstrated retroperitoneal abnormality. So for this, for a coder to build 76770, you should have all these organs examined and interpreted in the report. So we only had a kidney, ureter, and bladder ultrasound performed. So you would ask me, how do you code them for a complete ultrasound, Mr. Sandeep, right? Answer to that question comes in the next slide, which states that alternatively, if a clinical history suggests a urinary tract pathology, in such cases, a complete evaluation of kidney, urinary bladder also comprises of a complete retroperitoneal ultrasound, which means that in our scenario, did we had any clinical history of urinary pathology? Can you see any history of urinary pathology? Urinary tract pathology? Yes, isn't it? Exactly. We had in the indication the patient came for a status ureter reimplantation and to evaluate for the continued vesico-ureteral reflex, and that's your history of urinary pathology, urinary tract pathology. So in such cases, if there is a clinical history of urinary tract pathology, just a complete evaluation of kidney and urinary bladder also comprises of a complete retroperitoneal ultrasound. So again, so we also had a complete ultra evaluation of kidneys and urinary bladder as well, and that is the reason why, yes, option D is incorrect and option A is the correct one for this scenario. Okay, so how are you all doing? Coders, let me know in the chat. Did the explanation help? Okay, great. Thank you for letting us know. So, yes, the correct answer would be 76770, 26 modifiers at 48.816 and 13.7 and 28.81 and 27.0. So, that was our first scenario. Now, let's move on to the next one. Okay, here is the second scenario. And Ms. Katara, please, and thank you.
Okay. What are the CPT and ICD-10 codes reported? A 70470 T modifier TC C34.90 I67.2 G 93.9 G 23.8 B 70546 C 34.90 I 67.2 G 93.9 G 23.8 C 70460 modifier TC C34.90 I67.2 G 93.9 G 23.8 and D 70470 C 34.90 I 67.2 G 93.9 G 23.8. Case 2. Location independent diagnostic testing facility, radiologist employed by the facility. CT brain head with without contrast exam. CT head without and with contrast, August 5th, 2024. Comparison none available. History non-small cell lung cancer. Technique axial images of the calvarium without and with 125 cc's of Omnipec, 300 intravenous contrast. Findings: the calvarium is intact. Imaged upper portions of the maxillary antra show minimal mucosal thickening. The sphenoid, ethmoid, and frontal sinuses are clear bilaterally. No hydrocephalus, mass effect, brain shift, abdominal extraaxial fluid collection or mass. Calcification left basal ganglia without mass effect, nonspecific, likely benign. Abnormal but nonspecific decreased density in the periventricular and subcortical white matter of the cerebral hemispheres bilaterally without mass effect or enhancement. Most consistent with remote microvascular ischemic change present to mild degree. Bilateral intracavernous carotid and ventral arteriosclerotic calcification. Probable anterior communicating artery aneurysm 6 by 5 millimeters. Recommend intracranial CT angiography to further characterize. Conclusion number 1, no findings suggestive of metastatic disease. 2, probable 6 times 5 millimeter anterior communicating artery aneurysm. Recommend intracranial CT angiography to further characterize. Cerebrovascular arteriosclerosis. 4, nonspecific cerebral white matter lesions, most consistent with remote microvascular ischemic change. 5, Calcification left basal ganglia, likely benign. However, recommend continued imaging follow-up. And you have 2 minutes to solve.
Awesome, awesome, awesome. Great answers in the chat. Okay, good. So let me walk you through this one. So we have location independent diagnostic facility, radiologist employed by the facility. So that is keep an eye on this particular line. CT brain head without followed by with contrast exam, non-small cell lung cancer without followed by with the contrast, and the findings no suggestive finding of metastatic disease, probable communicating artery aneurysm, cerebral arteriosclerosis, non-specific cerebral white matter lesion, calcification of left basal ganglia. And that's all we have. And this is our procedure inventory. We have CT of brain or head without followed by with contrast exam. And in diagnosis inventory, we have small cell lung cancer, probable anterior communicating artery aneurysm. Since this is a probable condition, we won't code those probable condition in outpatient basis. So we will remove them from our diagnosis inventory, and we have non-specific cerebral white matter lesion, calcification of left basal ganglia, and cerebral vascular arteriosclerosis. And these are our ICD and these are our CPT code options as well. So these procedures, the CT, MRI, etc., are actually classified in the CPT based on their location as well as whether they have done without a contrast exam, without the administration of a contrast, whether the CT or MRA are taken without a contrast administration, or they have been taken with the contrast exam, contrast administration. And the third one is whether the CT or MRA has been taken without a contrast exam followed by a contrast administration. So you can see how they are classified in the CPTs. They will be in a similar manner, which I've just explained. Okay, now let's come back to this scenario. So we have option B, 70546, which is coding for a magnetic resonance angiography of head, MRA of head without contrast. Now let's cross check with our procedure inventory. We had a CT of brain performed and not an MRA. That means option B is incorrect straight away. And yes. Okay, so option B is incorrect, and option C is coding for 70460. That would be for a CT, that is a computed tomography, head or brain with contrast material. So let's cross check once again with the procedure inventory. We had CT of brain or head without contrast exam followed by with contrast exam. Yes, without contrast administration followed by contrast administration, and then they have taken the CT brain, a CT of brain or head. So option C is also incorrect because that's only coding for CT of head or brain with contrast material. So option C is incorrect. Now last remaining option is option A and option D. Both are having the same CPT 70470, and that's coding for a CT of head or brain without contrast material followed by contrast material and further section. So this is exactly what we were looking at, and that matches our procedure inventory as well. Now I can see the major of the split in the chat is between option A and option D. So that's where the term which I've just mentioned in the beginning of uh, the scenario comes into play. That is, if you look into the first line, you can see the location. It's an independent diagnostic facility, and the radiologist is employed by the facility. So option A is coding for a technical component, DC modifier, and option D is not having any modifier. That means it's a global procedure. So as per the CPT guideline, when the facility and the providers are employed by one entity, that is what happened in our scenario. The radiology center employs the radiologist. You can see it's been documented as well. In such scenarios, the service is considered to be a global service. Yes, exactly. So when the facility and provider employed by one entity, that is going to be a global service, and we don't have to append any modifier to the CPT codes. Yes. So we don't have to append this professional component or the technical component. That would be a global service. So with that said, in our scenario, since a radiologist has been employed by the radiology center, we won't be appending any modifier, which means option A is incorrect, and the correct answer is going to be option D, 70470, C34.90, I67.2, G93.9, and G23.8. Okay, any questions, coders? Did the explanation help?
Thanks for tuning in, and until next time, happy coding!